Post-operative catheter care is just as important as the fistula repair itself. If the catheter gets blocked, the bladder will expand with urine and put pressure on the repair, which can lead to its failure. Secure the catheter with durable tape and create space between the leg and the catheter, so it can move freely without twisting. Train the nurses to look for kinks in the catheter every time they check vital signs. Check the catheter yourself during rounds and empower your patient to notify the nurse if they have concerns. For smaller fistulas, keep the catheter in for 10 days. For larger ones, or if the urethra is involved, keep it for at least 2 weeks. Before removal, use dilute methylene blue to backfill the bladder under vision and while holding a small gauze over the urethra. If there's no dye leakage from the repair site, remove the catheter. Keep the patient in for 24 hours after the removal to make sure she can void. Your patient should not go for more than 3 hours without emptying her bladder, so if she must travel a long distance home, give her an adult diaper for voiding during the trip.